Morning. I am Leah Brick. I'm the Executive Director for Sash, and I'm really excited to be here with all of these esteemed people. With me today is Matthew Hedelius, our Sash President, Shan Jumper, the President of ATSA, Chris Farriello, the President of AASECT, and Zoe Peterson, the President of Quad-S. Thank you all for being here with us today.
Thanks for having us.
Leah.
So glad to have you. So just want to go over the housekeeping items so that those are handled before we jump in. Just as a reminder, we have our break rooms open and our exhibit hall open so that you handle, that you go see our sponsors. They're doing little mini sessions over there. People have been asking me, and if you want to see me, you want to come drop in and see me, I'm manning the break room all day. So if you have questions or your problems, drop in the break room and you can see me, and I'll handle those very quickly. There was some questions about the CEs, and those are all listed on the website, what sessions do and don't count for what hours, and your CE survey will come out after the conference is over. So you'll fill out that survey and then you'll be able to print your CE certificate. Of course, I want to thank all of our sponsors that have joined us on this journey. Paradise Creek, PCS, The Meadows, Sante Center for Healing. I know I'm forgetting somebody because my mind just went blank. So please know Pine Grove. I know Pine Grove, I'm not slighting you. My mind is not quite coffeeed up yet this morning. Uber Lube and Begin Again Institute, all of those folks, thank you for sponsoring our conference. Really appreciate that. Our format for today, so that you kind of know how things are going to go, is each of the presidents will take about 10 minutes to talk about their organization. What they're going to do is describe for you what sets them apart, what their membership profile is like, and then the state of their organization and things that their organization has been doing that they are most proud of. Then we'll drop into some questions for the panelists that we have prepared. But if you have questions yourself that you would like to ask, I want you to drop those into the Q&A. So there's a Q&A at the bottom of your Zoom screen. Just open that up, drop your questions in there. I'll be watching for some of those, but if I miss them, then my co-host is going to give me a little poke and she'll let me know that there's some other questions there. And what I'd like to do is start with Matthew and have you share a little bit about Sash, some of our vision, and how this panel came about.
Well, thank you, Leah. It is wonderful to be here. And I would like to just first, before we get to the items of this panel, is just thank our conference committee who have done such a wonderful job of pulling this off. All of you online here with us know what this is like. You're doing it in your own organizations, and it's really miraculous as far as I am concerned. So I want to just thank Leah Brick, she's our Executive Director, Mary Deach, who has our past president and has been on the conference committee for years, Steve Devlin, who is our conference chair and has been the chair for a number of years, Alan O'Brien and Daryl O'Brien. Daryl's our project manager and taking care of many of the technical things, and Mark Drax. And so just a very great appreciation to them. And then especially for this panel, I would like to just welcome our friends and colleagues on this panel, Dr. Zoe Peterson, who is the current president of the Society for the Scientific Study of Sexuality. Looking forward to hearing from you, Zoe. Dr. Chris Farriello, the AASECT president, and wealth of experience in human sexuality, and Dr. Shan Jumper from ATSA, the Association for the Treatment of Sexual Abusers. And I think this is just a great, diverse group. And the idea for this came about several years ago as we started talking as a board and as conference committees. And I don't think necessarily that the idea originated with us. I'm sure many organizations have had this idea and have done similar things. But we started to wonder, how can we bring people together? Because it seems like, by and large, we're really working towards the same thing. And sometimes we notice, as I'm sure our colleagues here online with us have, that sometimes on listservs or in literature, different conferences, that things can get a little territorial. And our thought is there's really no need for that, because we're really working towards the same thing. And that was driven home to me more specifically when we have the opportunity to meet Wednesday night and have a discussion and discuss the reality that, you know, we're working to relieve human suffering. We're working to enhance the quality of life for individuals of diverse populations throughout the world. And so I'm just very grateful and excited to have this opportunity. And as I was looking to do in preparation for this, I looked up the vision statements and mission statements and goals of other organizations, and there are uniquenesses in each of those, but a lot of similarities. And I'm looking forward to hearing from that, each of you, and any questions that come up. One of the things that we're most excited about in terms of Sash right now, I guess two things, is one, the credentialing process that we launched at last fall's conference. And you know, we've had some questions throughout the year. Why did we launch them if there are similar type things in other organizations? And our answer to that is we feel strongly about training individuals, and we feel strongly that the world is diverse enough that there are many paradigms that we can come from in terms of offering training and credentialing in some of the same areas. And we want people to know that a credential at Sash certainly is not mutually exclusive with a credential with AASECT or ITAP or other organizations. That there's training that's unique in all those organizations and those paradigms that can help us be more effective clinicians and scholars and researchers. So we are excited about that. And Dr. James Olson has been the chair of that credentialing committee for the last, since its inception. And he's going to be stepping aside shortly. We're looking for a new credentialing chair. And so a call for help. If anybody believes that you're qualified or thinks that you might be qualified and have interest, please let us know, because we'll very likely put you to work very quickly. In fact, we have a meeting Monday morning, so if you want to join in, you're welcome to. But along with this, we, as I talked yesterday in my presentation, Sash has evolved over the years and gone from the term sex addiction, sexual addiction, to the phrase of problematic sexual behavior. And we feel that this more appropriately fits a sexual health perspective and all of the issues that we're dealing with in terms of human sexuality. And so as a result, as I indicated, our journal has changed from Sex Addiction and Compulsivity, the Journal of Treatment and Prevention, to the Journal of Sexual Health and Compulsivity. And we're very excited about that. It's a quarterly journal, and Dr. Shane Krauss from UNLV, Department of Psychiatry, is our new editor-in-chief. And if you've not met him, you will, and he's going to be doing some webinars for us. He's on our board, and I know he's at the virtual conference this weekend, and just a great individual and very personable. And I think that you'll really fall in love with him as a scholar and as a scientist. He's done a great deal of research in recent years on compulsive sexual behavior disorder and the ICD-11 that will be coming out shortly. And so we feel like we're in very, very good hands. And one of the things that we love about Shane is he's a strong scientist rooted in empiricism. And as I was thinking about this discussion this morning, probably 20 years ago, we could probably get by with saying things clinically, well, this happens because of this, or I think that this or that. But we don't have that privilege anymore. And quite frankly, that's probably not even ethical practice to do that. If we're saying something to patients or clients that we're working with, we need to make sure that we're saying things and using interventions that are rooted in empirical research and science. And so that's why I'm so happy to have Dr. Peterson here, because her organization is dedicated just to the scientific study of sexuality. And I know that AASECT has been involved in research for many, many years. And the Atsu Journal is a regular publication. I think it comes out just about monthly. It seems like I get one just about monthly. And there's 4 or 5 good solid articles that are empirically based every month. And I also work with individuals who offended sexually, and it's a great resource. And so as I look at the population of Sash, our community, we're probably one of the small, I think we are the smallest organization within this panel right now, but we're proud of who we are, and we're proud of the direction that we're going. Most of our members include practicing clinicians, many who have traditionally been in the field of sexual addiction as we've known it, but I think that even our membership's paradigm is broadening to a field of sexual health. And we're coming more online to recognizing the trauma that partners have experienced as a result of problematic sexual behaviors. I think that there's also many clinicians in our organization that are practicing in just general sexual health issues in terms of enhancing sexuality in relationships, doing sex therapy and working with things that just aren't working in a committed relationship or otherwise. So we're very, very happy about this. And we want Sash to know, and our colleagues here, that this is not, although this is the first time, this isn't the last time that we plan to do this. We want to do this on an ongoing basis. We hope that you'll come back and join us either as speakers or as panelists. And I personally plan to attend your conferences as I'm able, and look forward to being there in person with you and having dinner or something on one of these nights. So thank you for coming. And just one last thing in closing, as we look at trying to be inclusive and with our friends and colleagues, tomorrow we're having a panel with 3 individuals who have, again, very diverse backgrounds. Dr. Eli Coleman, Dr. Marty Klein, and Dr. Alex Katahakis, 3 different paradigms of treating problematic sexual behaviors. And I'm very confident and excited that they're going to come together, and it's going to be a wonderful talk. And I would just put out a plea to all of SASH members that as we see these panels and these presentations, that we get in touch with our right brain here and the human side of us, and feel the connection that we have with these wonderful colleagues of ours. And as we then see things on listservs or in literature, on social media forums, that we be the one to engage this right brain of ours in compassion and empathy, and be a source of good. And and a leader for ethics and kindness. That's what's really going to enhance our field together. And I just look forward to that, and believe that we as an organization can do it, and believe that we can work hand in hand with these other organizations. So thank you again for coming, and I look forward to discussing these critical issues with us today.
Thank you, Matthew. Who would like to go next?
I can go. Just to introduce myself, I'm Zoe Peterson. I'm a faculty member at Indiana University, so I have a joint appointment in counseling and educational psychology and the Kinsey Institute. I am licensed and trained as a clinical psychologist. So our organization is a research organization, but I am both a researcher and a practitioner. And my research area is in sexual assault and sexual violence. So I am the current president of the Society for the Scientific Study of Sexuality, or we call ourselves Quad-S. So our organization, I think, is the oldest here. So it was informally founded in 1957, but we weren't officially incorporated until 1966. Things were a little loosey-goosey in the late 50s and early 60s. So it was just kind of a group of researchers that got together to talk about sexual issues. So I think we were just barely ahead of AASECT in terms of official incorporation. And as Matthew said, our organization is primarily focused on research. So that's our primary mission. So I'll just tell you what our mission statement says. Our organization is dedicated to advancing knowledge of sexuality and communicating scientifically based sexuality research and scholarship to professionals, policymakers, and the general public. Quad-S fosters a worldwide community of diverse professionals committed to scholarly and scientific approach to acquiring and disseminating accurate knowledge of sexuality. And as a society, we believe that the freedom of inquiry is essential for the promotion of human welfare and the reduction of ignorance and prejudice about sexuality. So I share our mission statement because I think as we're going to talk about overlaps among our organizations going forward, I think there's a lot of overlaps, as Matthew said, among our mission statements. So we are also a somewhat smaller organization. So our membership kind of bounces around a little bit, but we're usually sort of around 500 members, give or take 100 here or there. And I think our executive director and treasurer might disagree with me, but I'm going to argue that our smallness is actually a strength. I love that we're kind of a small, intimate organization. I think it's really easy to join as a new member and get integrated into our organization, to join committees, to get to know people. Our members are very interdisciplinary. So we have researchers who are in public health and psychology and anthropology. We have historians, we have theologians, we have nurses and physicians. So really kind of a wide breadth. But I think it's also really important to say that we're not only researchers. So a number of our members are therapists and educators who don't do research as their profession, but who want their work as educators and therapists to be informed by the research. So we are an organization for people kind of across the sexuality field, so not only researchers. Our members are international, although we're largely from the US and Canada. We have a big Canadian membership, but do have members represented from kind of across Europe, Australia, and Mexico, so a few other countries. So I think there's a few things that we're particularly proud of at Quad-S. Like I think all of my colleagues here, our organization has an annual conference. And this is where I think our being a small organization is really an advantage. I love our annual conferences. I think attendees almost universally describe them as kind of warm and friendly and welcoming. It's great science, but also in a sort of, you know, family-like environment. I think most of us who have been in Quad S for sometimes feel like Quad S members are our kind of academic family or our professional family. So if you're interested in trying out our conferences, we're of course online this year, which I don't know how that will, how our warmth will translate to a virtual conference. But the good news is what we're trading in kind of warmth and intimacy. We're getting a much more affordable conference. So our conference is very inexpensive, very accessible. So it's November 19th and 20th of this year. So our conference, I think, is a great source of sort of the latest research on sex and sexuality. Another thing that I think we have been really focused on in Quad S, and this has kind of been true throughout Quad S's history, is that we're an incredibly student-friendly organization. So sort of from its inception, I think, the organization was really kind of devoted to training the next generation of sexual scientists and practitioners. So that has been sort of central to the goals of our organization. So about a third of our members are students. A large number of the presenters at our annual meeting are students. I started at Quad S as a student 20 years ago, about 20 years ago, and gave my very first conference presentation at Quad S. And I think, again, we're just sort of a like warm, welcoming place. It's a safe place for students to practice presenting. You'll get, you know, kind, constructive feedback for the most part, I think, at our conferences. We also have an ambassador program, so students can help work at our conference for reduced fees, and it's a good way to sort of meet people at the conference. And we have a mentorship program for students and early career professionals. So we help to match up students and early career folks with more senior professionals. And so this is, again, both researchers, therapists, educators. You can help find people in your sort of focus area to serve as mentors within our organization. Although our mission is research, that really includes disseminating research and disseminating knowledge. So we do offer continuing education credits. We're not a credentialing agency, but we offer credits for AASECT, for psychologists, and for other kinds of licenses. Right now, most of our continuing education is through our annual meetings, so at our conferences. But one of the initiatives that we're really working on, and I think feel kind of passionately about, is that we really want to expand our CE offerings. So we have so many members with fantastic knowledge, and so we're really thinking about ways that we can expand to webinars and to home study types of continuing education. And then I'll finally just mention that we're the organizational home of the Journal of Sex Research, which is currently rated as one of the top interdisciplinary social science journals. I know I'm biased, but I love our journal. I think it's incredibly diverse. So it covers sort of all aspects of sexuality. It's methodologically diverse. So we have qualitative studies and quantitative studies. We have sort of basic science and applied research. So I think our journal is fantastic and just worth reading to kind of stay up on the field. So that's what I'm sure I'll say more things about our organization as we go on, but that's kind of mostly what I wanted to say. But I also just want to really thank Leah for organizing this and thank Sash for having this. This is a fantastic idea. And frankly, I'm a little bit competitive, so I wish I'd thought of it first. I think this is it's really great to bring us together and have these kind of conversations. So thanks so much.
Thank you. Who would like to go next?
I can go next. Good morning. My name is Shan Jumper, and I'm the current president of ATSA, which is the Association for the Treatment of Sexual Abusers. I just want to echo what Zoe said and thank Leah for inviting me. I'm really looking forward to, and already just in preparation, learning so much about the different organizations and finding out how much we have in common. So I'm excited that this opportunity can lead to just more efforts to work together. I think in general, overall, we really do all want kind of the same thing. So it's exciting to know and learn more about other organizations and to hear how other folks are going about it. For my day job, I've been working in the field of sexual violence since about 1991, when I first started working with men who sexually harm, when I was getting my master's degree, and then I worked for a number of years with children and families affected by sexual violence, which kind of brought me back around to the desire to work on the other end of the business and try to help these men and prevent more victims. Currently, I'm the clinical director at the Civil Commitment Center in Illinois for men who sexually offend. So our clients come to us from prison. We get a very small, select, high-risk group of men who sexually harm. And I have been in this, I've been with this program for 21 years. So, and I've been the clinical director of that program since 2005. It's always kind of an interesting thing. I think my longest job before this one was 2 years because I tended to get bored easily and would just want to move on to a new challenge. And I haven't hit that marker yet. It is a fascinating field. We get the chance to work with a lot of great people, and it's a natural learning environment that I find very rewarding. But ATSA has, we are currently, I guess I would say, the world's largest membership organization for professionals who work pretty much exclusively with individuals who sexually offend. We are a nonprofit organization, and we're dedicated to making society safer by preventing sexual abuse. Kind of our mission statement is basically that we promote sound research, effective evidence-based practices, inform public policy, and collaborative community strategies that lead to the effective assessment, treatment, and management of individuals who have sexually abused or are at risk to abuse. And our vision statement, which is much shorter and I like a lot better, is just simply a world without sexual abuse. ATSA was formed in the mid-'80s in Oregon and they're initially called the Association for the Behavioral Treatment of Sexual Abusers. It was a group of clinicians and researchers who got together each month to talk about how to treat the patients at Oregon State Hospital that were there for sexual aggression. And from that, it just kind of grew to these monthly meetings where folks would get together to share ideas and try to find the best ways to help our clients at that point in time. From that emerged a desire to kind of develop practice standards for evaluating and treating individuals who sexually abuse, because back then at that time there were no standards that existed. We held our first annual conference in 1987, and we've continued with a yearly conference uninterrupted since that time. And the behavioral was dropped from the name in the early 90s to just kind of more accurately represent the broadening scope of inquiry and the changes in the field. We also have our first virtual conference coming up. It's actually next week. So we're really excited to see how that goes. It was kind of touch and go there when all the craziness in the world started about what was going to happen with conference. And our staff has done a great job of putting together a conference. I think the experience is similar to what Zoe was saying about, even though we are a larger organization, it is still, that annual experience of physically coming together and being in the same place and socializing and networking and just connecting with each other is always so powerful, especially in working in an area that a lot of people in the general public don't understand or are confused by. And so to just gather physically in the same place and feel that sense of connection and acceptance has always been exciting. So I don't know what what that's going to feel like virtually. I think similar to what Sash is doing, we're trying to create the closest imitation of that we can on a computer screen. And so I'm sure it won't be the same, but I know that actually our registration numbers are up. We have a lot more registered for the virtual conference. It's going to be, it's cheaper. There's no travel expenses. And so one good thing is that I think we're going to be able to reach a lot more people, or a lot more people who typically aren't able to participate will be able to do that. And then we're curious to see how, how this affects conferences, going forward. And so a lot of kind of uncertainty, but a lot of excitement and a lot of potential about that. ATSA really is the only organization that we approach prevention of sexual violence from the perspective of understanding those who commit sexual harm versus the traditional approach of teaching people how not to be victims. And I think this perspective creates a potential for ATSA to make a big impact in creating a world without sexual violence. We do partner with a number of victim advocacy organizations, and we're hoping and working actively to expand those relationships and those connections. One of the things ATSA does pretty consistently, and it sort of is known for in our little corner of the world, is we develop and regularly update a professional code of ethics for our members, and as well as treatment standards for adult males who sexually offend. And we also have standards for adolescents who engage in sexually abusive behavior. And the standards have gone, over the years become more recognized and are widely accepted throughout the international professional community, and many districts or states mandate that professionals who provide sex offense treatment, comply with, or there's an expectation that the ATSA standards are followed. Our executive director is Maya Christopher. She has been our executive director since 2008. Maya was, like Leah said, scheduled to be here this morning to present, and she is ill. And so she's someone who works very hard, and somebody you almost have to tie down and make them rest when they get sick. But I know she's sorry for missing this opportunity. We have a volunteer board from among the membership of about 16 individuals. Half of those are elected directly by the members, and half are appointed by the board. We have just a little over 3,000 members from 18 countries, though like Quad S, the largest portion of our members are from North America, United States, and Canada. I imagine we probably have a number of people who belong to both of our organizations. We have psychologists, social workers, a lot of researchers, educators, victims' rights advocates, law enforcement and court officials, correction officials. We also have a pretty large contingent of student memberships, and we have a student representative who sits on the board of the organization. And we have a similar approach to what Zoe was saying. We do feel a responsibility to mentor and nurture young professionals coming into the field to ensure that we survive, because we won't be around forever, unfortunately. ATSA, we have a very active listserv for our membership, and ATSA's journal is called Sexual Abuse. It's published 6 times a year, and Dr. Michael Cito is the current editor for our journal. Just a few other things. I think we had been striving, to really kind of hit that 3,000 membership mark, which we obtained a couple of years ago. So we were very excited about that. We're actually making some changes to our membership categories, making them much less complicated and more user-friendly. So basically boiling down to 4 categories of members that we're hoping will improve our inclusivity and make it easier for folks to join ATSA without having to jump through lots of hurdles and go through all kinds of hoops. So we are really excited to roll that out this coming year and see if that allows us to grow our organization even more. I think the other thing we're going in terms of the direction of our membership is we're kind of in the early stages of what we hope is going to be an ambitious fund development campaign. In our current strategic plan, the organization, we're trying to expand the scope of what we do. We are focused on and have always been largely a member organization, and we want to continue to provide that same level of quality and resource and service and connection to our members. But we also feel that, we have a kind of a responsibility as people who study or work at prevention of sexual violence from the perspective of individuals who are caught up in committing that we want to take a bigger role and a more active role kind of on the international stage in becoming a stronger voice for the prevention of sexual abuse. So we are, like I said, it's going to be a little bit of a shift in focus or an expansion in focus and kind of an ambitious undertaking, but we're all very excited about that. And again, I just want to thank Leah for the invitation, and really glad to have the opportunity to meet Matthew and Chris and Zoe. And I'm hoping that we can stay connected and stay in touch and share ideas. And I'm sure there's lots of ways we can help each other.
Thank you so much, Sean. Chris, before you go, I just want to say to our attendees, if you were in Maya's session, we have automatically moved you over to Sean's, and Sean has graciously included information from Maya's presentation into his. So there was some overlap and he was able to get that information into his presentation. So you will get some of that information, and we're really grateful that you did that for us. Thank you, Sean.
Good morning, everybody. Thanks for being up with us so early. I know some earlier than others there on the West Coast, perhaps. And thanks to Sash, Leah, Matthew, and Mary there hiding in the background for doing this. I know this wasn't an afterthought. I remember Mary and I sitting on a bench having tea a few years back talking about how we can be better at collaborating. And I'm so glad that Sash has taken the lead in some ways in doing that. So I'm glad to be here, and I do hope we continue having conversations and collaborating like this. As I'm listening to everybody talk, I'm thinking, wow, we really are very much alike in how we're thinking and what we're doing. So hi, I'm Dr. Chris Farriello. I'm the president of AASECT. I have been working in this field since 1985, starting doing sexual violence work, and then going on doing a variety of other things. I've been a member of AASECT for over 30 years. And on the board now for going on maybe a total of 8 or 9 years in different capacities. And hopefully in the next 4 years, I'll be done with all of my work, and I can do other work that I'm focusing on, which is some of my own work. I own and run a group private practice that specializes in sex therapy with a few offices in and around Philadelphia. And it's sort of been on hold a little bit in growing this as I've been doing other work, but it's also important. But that's my own little corner of the world. I'll get back to that after I finish working on the bigger parts of the world. So who is AASECT? Well, AASECT was founded in 1967 by Patricia Schiller, which I can probably spend a long time talking about all the work that she has done and what she's implemented, including work with Planned Parenthood in the initial stages and some other organizations. She was really a leader in sexual health, starting with condoms usage and the like, way back in days when people didn't talk about such things. We are an organization of sexuality educators, counselors, and therapists, hence our name. We're known as AASECT. We're a non-for-profit interdisciplinary professional organization, and we've come to be recognized for our professional standards in sexual health, mostly through our certification process. In addition to the sexuality educators, counselors, and therapists, AASECT's over 3,000 members also include physicians, nurses, social workers, psychologists, clergy, lawyers, sociologists, other allied mental health professionals, marriage and family therapists, counselors, researchers, and students from a variety of different disciplines. We have members internationally. Currently, I should say that we're not necessarily certifying members other than 3 other countries, but working on other ways in which we could work better internationally. It's just difficult sometimes to coordinate standards of training in multiple countries, but we're continuing to work on expanding that. Currently, actually, working on that as part of our strategic plan. Our mission is devoted to the promotion of sexual health by the development and advancement of the fields of sex therapy, counseling, and education, and to the highest standards of professional practice for educators, counselors, and therapists. Our commitment to these high standards can be seen mostly in our certification process. Our certified members go through fairly rigorous, often to many people's complaints, too rigorous standards in becoming certified. It takes many years to go through all of the training needed to become a certified member, or certificate holder, as we call them, in our organization. But we are proud of our certificate process. We are looking to add additional certifications to for our members. And we are actually currently on a new mission to do a very extensive practice analysis to look at these current standards, to see if they still are, because they were developed over time, to see if they still are the foremost standards in the fields of sexuality. So we are beginning a practice analysis this next year that will probably last 2 to 3 years to really look at these standards, with the hope to eventually, if need be, adjust these standards so that they meet the current requirements for professional standards in this field. Our vision of sexual health, which is one of the things other than our mission that we abide by, affirms the fundamental values of sexuality as an inherent, essential, and beneficial dimension of being human. In general, AASECT opposes all psychological, social, cultural, legislative, and governmental forces that would restrict, curtail, or interfere with the fundamental values of sexual health and the sexual freedoms that we espouse. AASECT also opposes all abuses of sexuality, including but not limited to harassment, intimidation, coercion, prejudice, and the infringement of any individual's sexual or civil rights. One of the things years ago, we were really tightly knit with Quad S and SSSS. We still feel a very close affinity with those organizations. SSSS is the Sexuality Information and Education Council of the US. They're an informative body and an advocacy body. We, for a long time, didn't do advocacy work because of that affiliation. We have begun to do more advocacy work, and I'll tell you about that in a second. Because of our affiliation with Quad S, and many of our members are joint members with Quad S, we've moved from having our own journal, Contemporary Sexuality, to really relying on the journal and the great work that they have done and others have done. So currently our journal is an online publication that we do rather than a more formal journal. But some of the advocacy work that we've done has come in form of position papers based on research and best practice in the field. And those position statements have been around sexual health, identity, and human rights issues. So we have position papers on Black Lives Matter, sexual health, dignity and rights of transgender, gender non-binary, and gender non-conforming individuals, opposing bans on trans in the military. We have a position on reparative therapy, FOSTA and SESTA and the impact of consensual sex work, sexuality education, consent and sexual violence, abortion, touch for the certified professional, sexual expression, including orientation and identity, sex addiction, and the NCSF Sexual Freedom Resolution. These are just some of the AASECT position statements we've put out over the years, and we intend to do more as needed, both by the political climate and social needs. We hold, some of the ways in which we disseminate this information is through conferences. We also, like everybody else, hold yearly conferences. We also hold 1 to 2 institutes. Those institutes are smaller, usually of about 100 people, 200 people, really focused on a very specific issue. And we do those about once or twice a year. We also hold lots of other workshops through our CE providers. We actually certify providers, which are our members, that provide workshops and offer CEs for AASECT and for APA and ASW and marriage and family therapists across the country. And we are also in the process, as many of you are, looking at other ways in which we can create more online trainings for our members and others in the area of sexual health. And we have just begun that initiative actually in creating more online trainings that can be more accessible to people, not only for certification, but for, of course, just general knowledge and practice. We also offer special interest groups. So within our membership, we find that there's a lot of, because we're so diverse as an organization, for people to feel a greater part of the organization. We have a variety of special interest groups that we offer, so members can find their own niche community within the organization. And we actually use those special interest groups to provide insight into the greater organization. So they often do create opportunities for greater trainings, new insights, collaboration with other organizations. So they're not just a little body within our organization, they actually are sort of feet on the ground for us to really become better trained and better equipped within specific areas within our agency and within our organization, within the world, actually. Because we really believe in mentorship, we do have fairly extensive mentorship opportunities for people. And our members are also really great. I know for myself and others, I probably speak to about 2 people a week, at least, who are interested in the field of sexual health and want to know where to go, what to do. How do they become a sexuality professional? And I felt like I didn't have that 35 years ago. And I wish I did. And it's so nice to have so many people doing this work now where we can answer those questions and help people make good choices for them. So I'll end with saying, and there's more I know we're going to talk today, but I'll end with saying, I really do believe that we're better together. You're going to hear me say that more today, perhaps. I think focusing on, as we see in our political climate, focusing on difference doesn't serve anybody well. But just like in any relationship, noticing difference and figuring ways to collaborate, I think is our real strong suit. So I'm happy to be here and excited to be doing this work.
Thank you, Chris. Thank you all. So we'll jump right into our question. And what we're going to do is just those of you that want to answer, just go ahead and unmute yourself and answer that question. I also want to say that that was really informative to hear about the different organizations. So I hope that was helpful to our attendees who were not familiar with these organizations and how we really are working towards the same purpose. So our first question is, can you identify and address a misconception about your organization that people might have heard about your organization?
I could start on that one, Leah. Some of this I've already addressed earlier, but I think one of the major misconceptions about Sash, and part of this is because of what our former name was, and that is that we are solely a sexual addiction treatment organization. And as I said, we're much broader than that, and in fact we don't use the term sexual addiction anymore, as we've identified as problematic sexual behavior, which encompasses many different behaviors. So I think that is one. Another one that I've heard here and there is that we're not sex friendly or sex positive, and the reality is we are very much are sex positive. We in our vision of sexual health, if I could just read part of this, is sexual health, according to Sash's vision of sexual health. Sexual health is a label commonly used to describe a state of well-being in relationship to sexuality across the lifespan. It is often considered to have biological, psychological, sociological, and spiritual dimensions, and is more than merely the absence of a sexual disease or dysfunction. Sexual health involves managing the benefits, risks, and responsibilities of sexploration and play, of exploration and play, love and intimacy, pleasure and joy, as well as meaning making and spiritual transcendence. So we very much have the paradigm of sexual health being a state of sexual wellness and sex positive. And so I think those are probably two of the main misconceptions that we've heard in recent years, and are trying to send a message that of what we really represent in terms of human sexuality.
Thank you, Matthew.
This is Sean with ATSA. I think one of the misconceptions that people have about ATSA is that we are soft on those who sexually abuse, or abuser friendly, or hug a thug, I think is some of the terms. Not so much within the professional community, although that does exist also, but I think in terms of the general public, you know, and that I think that misconception is perpetuated by the notion that the average layperson has, that only bad, evil people who are monsters commit sexual violence. And, you know, we know that that's not true. And we understand that the vast majority of lives touched by sexual violence will have experienced this at the hands of somebody that was known to, cared for, or even loved by them and their families. And so, you know, we certainly understand the outrage and the shock, I think, that people often feel in response to media stories and things like that about, you know, more so even lately, these last few years with the Me Too movement and things like that. But, you know, we also recognize that the only way to really understand the origins of sexual violence are to understand the people who have engaged in it. So these are, you know, husbands, fathers, uncles, cousins, teachers, pastors, everyday people that you know, don't really deserve, although obviously have done things that they're ashamed of and wish they could take back, but to just label them constantly for the rest of their lives by that virtue of the worst thing they've ever done. I mean, I always ask people to think about, you know, think about the worst thing that you've ever done that you've not told anybody about, and if that became known and that became your sole identity. So I think that's probably one of the more common misconceptions that we have to battle with, and certainly in casual conversations with friends and other people that I meet. When I explain what I do, you know, I have to spend quite a bit of time on that. So, you know, we're hoping that we can start to change, you know, public's perception of just how to go about solving this problem. You know, we can't just ignore people who commit sexual violence and wish that they'll disappear and go away, because that doesn't happen. We have to learn to live together. And that, I think, is probably the most common misconception that I've come across.
Great, thank you.
Pertinent to this panel discussion would be really to talk about the belief that AASECT is not inclusive of CSATs and other people who do work with problematic sexual behavior. And I'm really looking forward to the discussion tonight on terminology, a couple of them today on terminology. And I will take responsibility to some degree for that, you know, because I believe that our position statement on sex addiction certainly led people to believe that we did not value the work that was being done and the realities of this work. The reality for our organization is that we have many CSATs as part of AASECT, and we have many of our you know, really fine members who have written books on compulsive sexuality and the like. We're very inclusive of that. Where we really got stuck was with the very specific term of sexual addiction as the end all and be all of the thinking around compulsive sexual behavior or problematic sexual behavior, out of control sexual behavior, one of the many terms to really look at the way in which this may fall on some continuum. And so we were really thinking about this more as a more comprehensive issue rather than simply a very finite experience. So I think the misconception is that we don't value any of this, and that's so not true. We value all of it, but we value all of it, not just pieces of it. And I think it's just a slightly different way of thinking about that. And we are very inclusive of this. And we, you know, I think, I think this is in some ways the beginning, hopefully a continuation of work on how to collaborate those many facets of this work that we're doing, so that we're all doing more of the same work and some maybe fringy or different work as well. But again, I often say we do this better together than we do apart. But I think that's the main thing that that people get stuck on, is they think we're not inclusive of people who are CSATs and others. But we certainly are. We have lively discussions on our listserv all the time about this.
Thank you.
So I think probably the biggest misconception about Quad S is that we are only an organization for researchers. So our mission is science, but that doesn't mean that all of our members are researchers. And as I noted, many of our members don't work as researchers. They work as advocates or educators or therapists. And many of our members, including me, are both researchers and clinicians or practitioners or educators. So I think this idea that, you know, we're only open for the scientists is a definite misconception. A large number of our members aren't actively conducting research right now. And they come to our conferences, both to be around like-minded folk, right? I mean, I think we all kind of are talking about this. You know, we do work that is relatively stigmatized, and so finding a group of people who value the things we do is really important. And they also join our organization because they want to stay up to date with the latest science by coming to our conferences and getting our journals. And I think one of the things I really like about Quad S is that the therapists and the educators and the advocates also present at our conference. So they present about their applied work. And I think that really opens up the possibility for that kind of bi-directional communication between the researchers and the people who are doing the applied practice. Because I think the researchers need to hear from the people who are doing the applied work, and certainly vice versa. So I think that's what I would really emphasize, is that we're open for non-researchers, really anyone who's interested in learning the research.
Great, thank you. All right, so our next question is really, and some of you have answered this a little bit, but I want to go ahead and address it anyways. It says, the question is, we haven't always seen eye to eye historically, and some of you already addressed that, but why do you think it's important that we collaborate? So you've addressed that a little bit, but I'd like to hear a little bit more, if you will, about why you think it's important that we collaborate and how we can.
You know, Leah, I could jump in here first again. And I agree that much of this question has been answered in the prior answers. As I was listening to Sean talk, I thought about some of the labels that he referred to of the individuals whom his organization works with, who historically have been referred to as sexual offenders. And I really like the terminology that ATSA uses. And when I think about this, I think back to my very first day in my clinical training after my master's degree. I got hired by a clinic that specialized in the treatment of sexual abusers. And my second day on the job was, we had group in the morning at 8:30, and my supervisor was gone, said, okay, you've got group tomorrow, and go at it. And I had never, ever done a group of sexual offenders. And to my knowledge, I didn't even know if I had seen a sexual offender on the street or in the clinic. And so, as is tradition, I was a new member of the group, and so they all went around and gave their introductions. And I've got to say that I was overwhelmed, and I was humbled at the experience that I had at that time when I heard the pain and anguish in these men's lives. Now, I realize that sometimes individuals in that situation can groom and can set people up. I don't really think that was the case that day. these were hurting men. And I had the thought at that time in my mind where I thought, if we're ever going to get to the bottom of this social pain in our community, this is where we've got to start. Because if we don't start here and fix this, we're not going to fix anything. And I made a decision at that point in time that I want to become the best I can be. Now, I know by no means think I'm the best there is, but I think that this population needs some of the best treatment and scientific research that's available. And as I look at my work, then inpatient and outpatient with individuals who have other forms of PSB, some who get involved in child pornography or contact offenses, some who have more organic processes of PSB. One of these issues doesn't just affect one part of the human sexuality spectrum, it affects all of it. And a partner who has a spouse who's been acting out sexually with other partners across the globe or the country, they very much have a sense of trauma, very much like primary victims of sexual abuse. And so I am grateful for other journals and other organizations and realize that Sash can't do it all, but yet Sash needs all the information. So I see that collaboration as just a great benefit to all of us.
Anyone have anything to add to that?
Yeah, so first of all, I was just going to say, as someone who personally researches sexual violence, like I would love to get into like a 2-hour conversation with Matthew and Shan about all the things they're saying. I have so many thoughts and it's fascinating, but I do realize that's not the primary reason we're here. So, but I guess to sort of build on why I think it's important that we collaborate is, I mean, I think as we've talked about our missions, we have a lot of shared big picture goals. So I think it's clear that our organizations all value sex and sexuality as kind of an important part of overall well-being. I think we all want to promote sexual rights for everyone. I think we want to reduce sexual shame and stigma. And those are like big picture goals. And I think they're goals that a lot of people and a lot of organizations in this country and in other countries don't share and are actively working against. And so I think it's really important that we may have disagreements, but I think our disagreements are more about sort of the pathways to those big goals rather than the goals themselves. And so given all these outside forces that we are working against, I think it's really important that we sort of have each other's back on those big picture goals.
Thank you, Zoe.
Oh, I would agree with both Matthew and Zoe. And I think the other aspect or thing that kind of came into my mind as I was listening to both of them talk is that, you know, we do overall want the same broad things, which is healthy, safe sexual relationships and connections with other human beings. And, you know, we have to, I feel like what's missing or is, you know, there are organizations like ours, there are similar, you know, victims' rights. A lot of people want that, but we have to band together to be heard, I think, over the people that aren't maybe as interested in that. I mean, we're talking about a social problem that has existed since the beginning of time, really. And it's a monumental task. I mean, I really love ATSA's vision of a world without sexual abuse or a world without sexual violence. I mean, it is a lofty goal, but it's nothing any of us can do on our own. And so I see a tremendous value in organizations like ours with that similar purpose. Like I said, it's better together, it's louder together, we're more likely to be heard and taken seriously. And so that's what I would add to what's been said already.
Wow, ditto, ditto, ditto. Again, we're all in, I think, some sort of agreement here for sure. And yet it's taken us a while to get here. not just as different organizations coming together, but I think even within our own organizations, AASECT has gone through transition. I know we were much more divisive earlier on. I know there's a question in the chat box about, or the question and answer box about, has AASECT changed over time? Well, I can tell you we now have a SIG that's specially designed for people who are working in the area of problematic sexual behavior. So we said, hey, there's a group of people doing really wonderful work. Rather than fighting about this, let's put them all together, and anybody who else is interested in that, and figure out how we can use this to create better understanding and better practice for our members. So we've stopped resisting that in the same way. Not that there's still not people who have different, you're always going to have people who are going to butt heads with each other, but as an organization, I think we've really come quite a long way from where we were. And I know Sash has had its transitions as well, and its relationship with ITAP and other organizations. So I think we've all sort of evolved here, and we're at this place where we don't really need to look back so much anymore, but look forward. I can say that even at the end of our position statement on sex addiction, we say AASECT advocates for a collaborative movement to establish standards of care supportive of science, public health consensus, and rigorous protection of sexual rights for consumers seeking treatment for problems related to consensual sexual urges, thoughts, and behaviors. So we are advocating for collaboration around this, not for divisiveness. As said before, I think we are better together. Division doesn't help advance the field or the work that we're trying to do. It only allows for consumers to doubt the integrity of our work. And so we only shoot ourselves in the foot if we don't continue collaborating.
Thank you for that. And it really leads us to our next question, which is, how do we resolve our differences and the controversies of opinion that still remain, but still be respectful to each other, to have an open discussion? And should we be policing our own societies to ensure that we have a respectful conversation and environment? That's a big question, so I'll give you a second to think about that, and somebody jump in there.
I can go first this time. I think we're always going to have differences. People within organizations are going to have people within families. I have 3 kids. They don't always agree. I think we're always going to have that. I think respectful conversations about differences are important. We have our own measures of managing people on our listservs when they're in these pretty emotional conversations, which include things like, no direct attacks, things like that. But really, we want people to, we want to encourage people to share their different thinking, but not attack each other, just debate their ideas, their ideologies. As an educator and as a therapist, I know people, hear things differently, believe things differently, value things differently based on their own experiences, their trainings, et cetera, et cetera. I don't always know who's right and wrong. When I have a couple in my office, I don't think of it that way. I think of it as a system that needs to come together to come to what's right for the 2 of them or several of them to work through together. And I think our way of doing that is through these meetings or summits or, sitting down, having tea together and talking about how we can do this, again, better together rather than differently. I love the idea of collaborating at these conferences. Panels are one idea, but continuing to invite each other to present at conferences as well, because again, then we share those different visions, those different ideologies, those different trainings with each other. So I think collaboration is the answer, and I think doing what we can to police our own organization so there's less infighting, creating more opportunity for difference, like we said, creating a SIG rather than cutting people out. It's really how I'm hoping to change things very drastically in AASECT.
Thank you.
Yeah, so I think this is a really tough question, and it's one that we're struggling with in some ways at Quad S, because I think, the controversies aren't just between our organizations, as Chris kind of noted, they're within our organizations too. And certainly within our organization, we're diverse in all kinds of ways. And so there's a lot of disagreements. And I think, obviously, we don't want to stop those discussions. I mean, I think our disagreements are about important things, and they're about things that relate to people's, health and safety and well-being. So we need to have those disagreements, and we need to have the discussions. And I guess as a scientist, I think whenever possible, it's nice if those discussions can be guided by research. So let's look at the research on each side of this controversy, and let's see what the research says. Let's evaluate the quality of the methods. Let's look at the conclusions that are being drawn. And if necessary, let's do more research. So that's, the scientist in me wants to say, well, we can have these discussions focused on research. But I mean, I think the obvious issue is that not all controversies are really things that can be answered by research. So just as an example, sort of in my own area of research, we can look to the research, and the research might inform a controversy about what is the best sexual violence prevention approach. But we can't look to the research if the question is, should we have harsher punishments for individuals who perpetrate sexual violence? Because those should questions are values questions. They're not really science questions. So our values might be informed by science, but ultimately it's a values difference. And I think it's those values questions where people are most passionate and they're most emotionally laden, and they're the hardest to talk about in ways that feel calm and respectful and professional, because people, have really strong feelings about their values. So I think this is something we're struggling with within our organization at Quad S, is should we police those kinds of discussions, and how should we police them, and how do we police them in a way that ensures respectful communication and professionalism without shutting them down, because we don't want to shut them down, because they're really important conversations. So I think we're still in the process of figuring it out. We recently initiated a new sort of values statement of our organization that offers sort of expected behaviors in our professional context. Here's how we hope people will behave. Here's the things that we really don't want to see in our interactions. So trying to set some guidelines without shutting down the conversation. But I think it's a work in progress.
Thank you. Anyone else?
As I was listening to this discussion and this question, I had thoughts of some of the territorialism that has existed just in my profession and my career the last 25 years. And as a case in point, I used to attend meetings at a hospital in the Department of Psychiatry, where there were many psychiatrists, psychologists, clinical social workers, MFTs, LPCs, and the moment I went in the meeting and started participating in that department, I realized there was a hierarchy. It was unwritten, but it went from the psychiatrist to the psychologist to the MFTs, LCSWs, and LPCs, and from there. And one thing I thought was very interesting is that although many of those professionals held doctoral level degrees, only the psychologist and the psychiatrist got the professional courtesy, if you call it that. At that point in time, it being called Dr. So-and-so, Dr. So-and-so. Everybody else was their first name. And even in the minutes of the meetings, the degrees would not be labeled in people below the rung of the psychologist. As I thought about that, I thought about the research that looks at different disciplines in providing therapy. And there's numerous research that shows if you just take a skilled practitioner watching a mental health practitioner doing therapy, for the most part, one can't tell and distinguish if they're a psychiatrist, a psychologist, MFT, LPC. It's their own individual skill. And I say that because I think that there is some degree of wanting our own professional identity, and I think that is crucial and important. But that identity shouldn't be or can't be at the exclusion of other ideas and others' individual professional identity. So I think that translates to what we do here. And I don't think any organization or anybody wants to be policed and legislated to have to respond a certain way. Certainly, I'm my best legislator, that I monitor myself, I moderate myself, and if I have differing opinions and even strong opinions, I can say that in a respectful manner. And I think that's what Chris referred to and Zoe as they were talking about this. But I also think that I can't live on an island. So even though 95% of my work is with PSB in the terms of compulsive sexuality or something to the effect, I can't stay there because that makes me awful dull as a person, and I think it affects how well I'm able to treat people. But if I could go to Quad S and learn hot off the press scientific research, I go to ATSA and learn some things and participate in ATSA, then I'm a better clinician to more effectively treat people with PSB, whether I ever even approach clinically a client with anorgasmia or erectile disorder. I'm a much better clinician. And so I think that we all have to probably broaden our thinking out a little bit to be inclusive. And if I'm feeling excluded, take maybe a self-efficacy approach and say, okay, what can I do then to try and counter that by being more inclusive? And that takes ego strength, and it's a hard approach, but I think it is one of the things we're going to have to do as we come together with our communities.
Thank you, Matthew. I really appreciate those statements, and it really leads to why we have two separate sessions today, one that is exclusive to ATSA and one that is exclusive to AASECT, is because we really wanted to help our attendees to learn more from these other organizations and from the presenters and researchers that are providing that information. So look for that again. We'll be doing it again, and we're sorry that Quad S was at the beginning of the pandemic, and really we were really struggling to try and get that put together. So they'll be there. Just know that is not an taken away invitation. It is an open invitation. Let's move on to our next question, and let's talk about, we've talked quite a bit about our shared vision and stigma and shame, and is there an overarching topic or something that's happening in the field that you think is important, and how can we, that topic that's happening, what's currently important in the field of sexual health, and how can we help each other to deal with that area, to reach that area?
See, we don't have a lot of time left, so I'll be brief. Other than the continued issue around having access to adequate information and services around sexual health, really looking at the inadequacies, right, of care based on race and economic status and working around these inadequacies. So, AASECT itself has, in its strategic plan, really devoted ourselves to looking at these issues and seeing how we can help both our members and our communities having better access, to better sexual health care.
Yeah, so my answer is really similar, so I'll just expand on what Chris said. I think that is, I think that's a central issue currently, and I think somewhat related to that, I think we really need to work on the diversity among our sexual health professionals. So certainly within Quad S, this is something we're thinking a lot about, is how we can make our organization more welcoming and more inclusive of diversity broadly speaking, because I think, as Chris is kind of referencing, like with other health issues, sexual health problems disproportionately impact minoritized and marginalized communities. And so we need diverse voices within our field. And so I think, you know, maybe one thing we can all do together is we need to think about our individual organizations, but also talk about the pipeline. You know, how can we get more diverse students interested in the field of sexual health, and how can we attract them to our organizations?
Thank you.
And ATSA's doing a lot of the same things. It is certainly a very timely topic, kind of like Zoe was saying. We're looking at, you think we need to look within and really understand exactly how diverse are we when we don't ask, we don't ask that information, and then how much does our ATSA's diversity as an organization parallel the diversity that's in the field? And then is the field more diverse and ATSA just is not for some reason? That certainly tells us one way we can go. Or are we finding that there just aren't many diverse individuals working in the field, and that would provide us another direction? So that sounds like something we're all kind of focused on right now.
And just 30 seconds here. I think that we need to help send a message that sexual health is about sexual safety for all. And what it kind of breaks my heart to hear the statement that Sean referred to as hug a thug. If any of us have a loved one or a friend who has hurt someone sexually, that's painful to hear. And if we sat with those people, we know that there's an individual behind the behavior. But when you have that conversation with someone in the Me Too movement, it's also very, very painful. So I think as we change the vernacular in our communication, we talk about a sexual health perspective, sending the message that sexual safety is a goal from all of our organizations for everyone, and that there's a way that we can work together within organizations to help the public at large. And again, I think it goes back to me. What do I do? It's one thing to have this conversation online in a panel. It's a completely other thing to have a civil conversation in private with a colleague who may have different degrees or beliefs about another organization or group. And so I think it starts with me in terms of that change.
I'm going to add something just from my own experience. I grew up primarily as a clinician in the substance abuse world. And clearly in substance abuse, you have people sitting in your group that have sexual trauma, that have offended, and yet that is not something that is taught in those classes. So I didn't get classes that dealt with sexual health, that dealt with some of the topics that we're talking about. So I think that even in our shared mission, if you will, that we've got to broaden that to the other fields beyond sexual health so that clinicians are getting this information and that they're seeking it. We've made it pretty clear that we have a shared mission and that we want to work together. What if you had to say in a sentence or two, and we're down to our last 7 minutes, so I want to just be mindful of that. We've got one last question beyond this, but if you had to say in a sentence or two what our shared mission is, what would you say? And also to add to that, how can we hold ourselves accountable to that shared mission?
So I guess as I was sort of preparing for this and reading all of our mission statements, I mean, it seems like what's really consistent is this focus on education and dissemination of knowledge. So it seems like really, if you look at our mission statements, the thing we all agree about is that we have a responsibility to share accurate, empirically informed sexual information. And so I think to some degree we do this within our organization. So we have journals and we have conferences, but I think one way that we might be able to collaborate is kind of what you're saying, Leah, that there's a whole group of people who need this knowledge who wouldn't necessarily come to any of our conferences. And so thinking about ways that we might collaborate to reach an audience that's sort of beyond preaching to the choir, I guess, that's the audience beyond the members that come to our organizations.
Great, thank you.
I think in answer to this question, one thing that we can do in terms of that shared mission is be inviting. And I've got to say, Chris, I was very appreciative of what you've said about welcoming CSATs and ITAP and Sash credentials into your organization, and that you're providing groups for them to feel comfortable. That's wonderful to me, and I think it is to other people. And so I think as we are inviting, that's the thing to do to have this shared mission and to effectively then get this data to the end of the row within our own organizations and our subspecialties in the field.
Thank you.
The only thing I would add, I agree with everything that's been said, is, in terms of accountability, I think, we have to create a welcome atmosphere for the exchange of different perspectives on similar issues. And a good way really to do that, I do think, is educating. I'm just as in participating in this panel, I've learned a ton more about your organizations than I ever knew. And I think that, that really makes a big difference. And so I think we can each go back to our own organizations with that charge of sharing information and just informing our memberships about each other so that we have a more accurate understanding of what we're all doing. I think a lot of people will be surprised by how much we have in common.
Thank you.
Group hug coming on.
Yeah.
I think if there's anything we've learned about the current political climate, that again, divisiveness does not promote any type of coherence to wanting to be better. And I think I agree, changing that culture, the culture of the way in which organizations think about that as not competitive but collaborative, is where a lot of this starts.
Thank you. So that leads me to our last question, and it's why should members of Sash or members of your organization be a member of the other organization? So if they're a member of ATSA, why should they also be a member of Sash? Or if they're a member of AASECT, why should they be a member of Quad S or ATSA? Can you address that?
I'll jump in again. I think for me that it's not about entering an organization and becoming a proselytizer and trying to get other members to come over to our side if there's a side. But I think that, again, we have two organizations here who provide great data in their journals that I won't have access to unless I'm a member or associate with the organization, and I need that information. And so that's why I will do that. I don't know that I have the bandwidth right now to become AASECT certified, but I certainly want to know more of the information that they're presenting at conferences. And so I plan to be involved in this next year. And I think that will make me a better practitioner. And I think it will also help me in my work with Sash as we share this shared vision and community work.
Thank you, Matthew. Anyone else?
I just think briefly, if more of us belong to each other's organizations, we'd probably find collaboration a lot easier.
Distance and silence isn't going to benefit anybody. And as Sean said earlier, just within this small group here, we've learned more about each other that I think have brought us closer together. Can you imagine what would happen if many of our members felt the same way and did the same things? So.
Yeah, I don't know what else to add other than I think that clearly talking amongst ourselves is really beneficial. And as I said before, I already want to have conversations with Shan and Matthew about my research interests and how it overlaps with their practice. And so I always think that sort of cross-disciplinary and cross-profession interaction is incredibly valuable.
Well, I just want to close with, and it's by saying thank you to all of you for being here. We're so grateful that you accepted our invitation. And I want to take just a second and read the Sash vision statement, because I think it really embodies this panel. And that is, Sash envisions a world where we can have an open, informed, and inclusive conversation about sexual health without fear of stigma or shame. I really appreciate all of the panelists today and their respect for each other, their respect for the profession, and that we were able to have such a great conversation. I hope that the folks that were watching us and sitting here were learning more about each other, about these organizations and why they should be involved, why they need to learn more about Quad S or AASECT or ATSA, or if you're from those other organizations and you didn't know anything about Sash and you're sitting here, that you have learned more about Sash and that you'll broaden your own interest. Don't forget to get into those AASECT and ATSA sessions today. We really want you to learn from those presenters. And once again, just thank you everyone for your time today. And we'll say goodbye.
Thank you.
Thanks so much for having us.
Goodbye, everybody.
Thank you.
Thank you.